Hi, and welcome to Breastfeeding Buddies. Today we're going to talk a little bit about hand expression, and I'm going to share some information from Nancy Moorbacher. She's a lactation consultant who's written many books on breastfeeding. Hand expression can be a useful skill for any mom that's breastfeeding. It can help relieve breast fullness, it can help stimulate milk supply, and it can also provide milk for your baby. So I'm going to show you a series of pictures while we talk about the steps of hand expression. These pictures are from wikihow.com, so you can also find these on the internet. So the first thing you need to do when you're getting ready to hand express is to wash your hands well. You want to find a clean collection container that has a wide mouth, like a cup or a bowl, because when sprays of milk come out of the breast, you want something wide so all of those sprays can be caught. Whenever possible, you want to plan to express in a place that's private and comfortable where you can relax, because if you feel relaxed, then your milk is going to flow a little bit better. There's many ways to hand express, so you always want to do what feels best and what expresses the most milk for you. Before expressing, you can put a towel moistened with warm water on your breast. If you leave it there for about 2 minutes, it helps with the flow of milk. You can also gently massage your breasts prior to starting the hand expression, because that again will help your milk to flow more freely. Whatever technique when you go to hand express, you want to make sure that you sit up straight and that you lean just a little bit forward so that gravity can help with the flow of milk. Whichever technique you use, the most important part is finding your sweet spot, or the area on your breast where the milk flows the fastest when your breast is compressed. And you'll need to try different finger positions until you find it. To do this, you want to start with your thumb and your fingers on opposite sides of your nipple, usually about 1.5 inches from the base. Some moms find it helpful to curl their hands and use just the tips of their fingers and their thumb. Several times apply steady pressure into the breast towards the chest wall. If no milk comes, then shift your fingers and thumb either closer to or farther from the nipple and compress again a few times. Repeat this process, moving your finger and thumb until you feel slightly firmer breast tissue, and when you put gentle pressure there, it yields milk. Some moms will find, when they find that sweet spot where they get milk, they might mark it at first with one of those small circle band-aids so they'll know where it is the next time they go to hand express. But after you've hand expressed a few times, you're going to automatically know where that sweet spot is and where to place your thumb and finger so you can skip that finding step. Apply steady pressure on the areas of milk in the breast by pressing back towards the chest wall, not towards the nipple. While applying inward pressure on the breast, compress the thumb and finger pads together, pushing in, not pulling out towards the nipple. So the idea is to find a good rhythm of pressing back, compressing the thumb and finger together, and then relaxing. And you want to do this in a rhythm, kind of like your baby would be sucking at the breast. You want to switch breasts every few minutes, doing it 5 or 6 times in total at an expression, while rotating your finger position around the breast. After you express in one area, the milk is going to stop flowing after a few minutes because all the ducts in that area will have been drained. So by moving your fingers around the breast, you're going to be emptying all of the ducts. After expressing, all areas of the breast should feel soft, and this process usually takes about 20 to 30 minutes. Hand expression should feel comfortable. If it's not, then you might be compressing back towards the chest wall too hard. You might be sliding your fingers on the skin or squeezing behind the nipple. If you do feel discomfort, you want to adjust your technique because it's important to find the method of hand expression that's going to work best for you. If you're expressing in the first few days after delivery, you're going to be expressing colostrum, which is a yellowish, thicker milk, and so you're probably only going to be getting a few drops. But later, when your milk has come in and you have a good supply, when you hand express, more than likely you're going to see sprays of milk coming out of the breast. Hand expression does take some practice, but it is an effective way to remove milk from the breast, especially if you're feeling uncomfortably full. And a great place to practice would be in the shower. We're going to be putting some video links in the comments section of this Facebook Live post, and so if you're interested in learning more about hand expression, be sure to check out those videos. So thanks for joining us today. We hope that you'll join us next week, same time, same place, next Tuesday morning at 10 o'clock for the next edition of Breastfeeding Buddies.